Meanwhile, cancer is second only to heart disease as the leading causes of death in the United States. So I spent some time at USF Health talking to doctors and patients about a new Neuro-Cardiac Program there. It brings cardiologists and neurosurgeons together. And I found out that by combining the knowledge of two different departments and discovering the heart-brain connection, they're actually preventing a stroke from happening before it's too late.
All of a sudden, I didn't want to go on trips. They weren't as fun. I couldn't do what I would normally do on a trip.
A couple of years ago, Dennis Green started to have difficulty breathing.
The quality of life was diminished. And so I knew I had to do something about it.
And that's when he met cardiologist Dr. Bibu Mohanty.
So over the last 2 years, we've been sort of walking him and guiding him through this process of fixing his coronary arteries. He had significant blockages. We were able to deal with that with a sort of a tailored regimen to allow him to go through that safely. We then fixed his heart valve. That again took a tailored regimen, took a little, creativity to figure out a way to get him through that safely.
But Green had other pre-existing heart issues as well.
And when about the age of 30, I started to have AFib. Now it's almost like a normal thing. I walk around, my heart beats funny. There's times when I have to stop and take a breath because it goes in an erratic rhythm.
And most patients who have atrial fibrillation, an irregular and often rapid heartbeat, need to stay on blood thinners to prevent a clot from forming and having a stroke. But taking blood thinners has been very challenging for Green.
And I can't take blood thinners. If you see my wrist, my arm, they just eat me up from the inside out, basically.
And that's where USF Health's new Neuro-Cardiac Program that Mohanty helped develop stepped in. A team consisting of doctors from both USF Health's cardiovascular science and the neurology department worked together to figure out a way to stop Green from developing blood clots.
So this pocket in patients with rhythm disorders, 95% of the clots that form within this pocket.
So they installed this device that would allow Green to come off blood thinners for good.
This is a device that allows us to block off this appendage non-surgically, right? This is placed by catheter-based techniques or small tubes through vessels in the legs, sometimes in the arms. And this allows us to block this appendage off such that it's as if it never existed.
And Green was able to witness this new medical advancement unfold firsthand.
It's an experience because through most of it, I was awake, and you can watch it on like a TV screen where he's going. He takes the wire to implant the stent. He takes the wire and puts it through your groin, and it goes all the way up into your heart, and he implants things.
And Green was so confident in the skills of the doctors and nurses at TGH, he drove extra miles just to be in their care.
I traveled 40 to 45 minutes to get to TGH. Rather than coming here to a closer hospital, which is really 3 miles down the road, only because I have such faith in the organization.
And that faith paid off, as Green is finally able to come off blood thinners with no future risk of stroke.
I'm very happy to have gotten to a point where I think he's going to be a lot better off.
Green is thankful to the doctors, nurses, and staff at TGH and USF Health for saving his life, especially Dr. Mohanty.
And he pushed for me to go in there, and for that I'm eternally grateful.